Lower back pain is so common, but how do you know when you should be actually going to the ER because it's an emergency situation? Today, we're going to be going over 3 red flags that you should look out for if you have back pain, and you should be going to the ER because it's an emergency case. Let's dive right in. The first red flag that we're going to be looking for is going to be a weight gain or weight loss of 10 pounds. And this is a sudden onset. So if you are working out or if you're trying to lose weight and you have those fluctuations, then there's a specific cause of that. However, if you have no cause or no specific reason in that gain or weight loss of up to 10 pounds and you have associated lower back pain, then that is considered an emergency case and you should be going to the ER to rule out one thing, and that's going to be cancer. So if you have family history of cancer, lower back pain, and a sudden weight gain or weight loss of 10 or more pounds, then hey, it might be a smart idea to go to the ER to make sure that it is not cancer related. The second red flag that we're going to be looking for is progression of neurological deficits. And there's 3 things that we're looking for within the progression of neurological deficits. The first one is going to be saddle paresthesia. That just means numbness around the groin. Now, what part of your groin? Great question. So when you are riding a horse, you see where that saddle goes, and wherever that body, your body touches that saddle area, near that groin, upper inner thigh, those areas, if it is numb, then that would be considered saddle paresthesia. The second one that we're looking for is any type of sexual dysfunctions. Now, it can be from pain with intercourse, it can be the inability to have an erection, the inability to ejaculate. Those types of sexual dysfunctions that are noticeable, that's the second thing that we look for. And the last thing we look for is bowel or bladder dysfunctions. Now, what does that mean? You don't have the control to pee or poop on demand, or you have the inability to push or incontinence. Those are the things that we're going to be looking for. Now, if you have these 3 things, and in particular the first one, that is going to be considered a red flag, and that should be an emergency case. It's suggested that you should be going to the ER for your care. The third red flag that we're going to be looking out for is some sort of major trauma. Now, this can encompass a lot of things such as motor vehicle accidents, slip and falls, especially if you're on the elderly side or you have history of osteoporosis. You're going to be a little bit more fragile and have a likelihood or higher likelihood of fractures, and you want to make sure that you can rule that out. Things like sports injuries, whether that's snowboarding, football, if there's some sort of major contact causing certain issues, then that might be a concern and a red flag causing you to go to the emergency room. Now, if you had some sort of acute trauma to the lumbar spine, there's 2 things primarily that we have to make sure. One, do you need to stabilize it because something is unstable, maybe from a fracture? Or 2, is there a hematoma or some sort of damage or blood clot that can form through the trauma internally, whether that's through the tissues, the organs, or the body cavity? Now, these are things that you can't really see unless you have imaging, or sometimes you can visibly see and feel. So by ruling out through the scans, you can rule out fractures, you can rule out hematomas and other life-threatening issues or matters that might be more time sensitive. Now, once you do that, then you can go back to the conservative care, such as chiropractors, massage, physical therapy, and even acupuncture. Those are going to be the things that you want to avoid or make sure you know that it's not, so you can get the proper treatment and heal faster. So we just went over 3 of the biggest red flags regarding lower back pain. And remember, red flags are a time-sensitive issue and should be treated immediately. And so that's why the emergency room is recommended. The emergency room is for time-sensitive issues and even life-threatening. And so that's the reason why we look out for these 3 red flags. If you don't have these 3 red flags and you have lower back pain and you're a little bit worried and you want to get checked out, go ahead and seek your healthcare professional at your nearest urgent care. Or if you have a good relationship with perhaps a chiropractor or a physical therapist, hopefully they can see you and make the right decisions to get the care that you might be needing. Now, before we end this video, I want to teach you one thing that you might be doing wrong, and that's foam rolling your lower back. Now, let me explain. When we look at the joints of your lower back compared to the mid back, you can tell that this mid back, even if there's pressure here, is going to be blocked by the joints. However, if we look at the lower back, if we have direct pressure here, it's going to slide because of the angle of this joint, this facet joint. Now that means that you shouldn't foam roll directly on your lower back. If you have been foam rolling your lower back the wrong way, this is going to be the best thing that you learned today on how to properly foam roll your lower back so you can avoid lower back pain. Most people are going to be foam rolling their lower back just like this. This skeleton is actually looking up towards the sky as if you're foam rolling facing up. Now, let me show you why this isn't good for your joints. If we were to flip this skeleton over, you're going to notice lines on the lumbar region, the lower back. You can tell that these joints are shaped differently when compared to the mid back right here. Now there's no line here, and then there's a line here. What that means is as we press, it's going to slide. Now, when we do that for our lumbar spine, it's going to start to aggravate the discs, the muscles, the ligaments, and the stabilizers muscles in the lower back. And that's why you shouldn't foam roll your lower back directly on the spine. So here's the trick. What we're going to do is we're going to angle our body to the side and then foam roll. Same thing on the other side. We're going to angle our body and then foam roll. That's going to be much safer so that you don't aggravate the discs here or the ligaments, the nerves, the joints, and you should find more relief when you are foam rolling your lower back at an angle than directly on your back like this. So here's the proper way to foam roll your lower back safely without compromising the discs, the joints, or re-aggravating your lower back when you're actually trying to help it. Again, most people have been doing it straight on their spine, which we showed that it's not safe or it's not good for your lower back. So the key is to either lean to the left or lean to the right, just about 20 to 40 degrees on your lower back. So here we go. We're going to lean to our left and we're just going to go up and down right along the spine, but not directly on the spine. Again, we're angled to the left or angled to the right. And we're going to be foam rolling the bulk of the muscles on our lumbar spine. Remember, foam rolling is more for the muscle, not really the joints. So we want to target our muscles and not aggravate or compromise the joints. I hope you found this video valuable. Please help support our channel by liking and subscribing. We plan to make more future videos for our subscribers. So if you have any suggestions, please comment them down below. Aloha.